I am very much thankful to the Ayur Tarang, the persons who are associated with Ayur Tarang, and the audience who are hearing this lecture class. Thank you all. I have taken one class about Jwara. Now we move on to the Shamana Prayoga in Jwara Chikitsa. So we shall directly go into the subject. What is Shamana? According to Ashtanga Hridaya, Acharya Vagbhata says, Na shodhayadi yad doshan, saman nodirayatyabi, samigarodi vishaman, shamanam tacha saptatha. Shamana medicine does not eliminate the doshas, and it does the it does not udirana, it doesn't excite the doshas, and it does is samikarodi vishaman. It makes the doshas in the normal status.
Sure, but first you have to unlock your device.
So that is what called as Shamanam Tacha Saptatha. So 7 types of Shamana he is explaining. So Shamana, the medicines, does not increase the dosha or eliminate the doshas. It does not excite the doshas, and it subsides the doshas, makes in the normal position, and samavastha is maintained. Without exciting, without eliminating the doshas, it makes the status of dosha in the samavastha. So that is called as Shamana. So Ashtanga Hridaya, the Vijobakramaniya Sutrasthana explains 7 types of Deepanam, 7 types of Shamana procedures, that are the Deepanam, Pajanam, Kshutra, Vyayama, Atapa, Maruta. What are they? Deepana, which increases the Agni. Pajanam, which is digestive. Kshutra, that is hunger. Trid, thirst. Vyayama, exercise. Atapa, sunlight. Maruta, and Vayu. All these things are utilized for Shamana. So what is meant by Shamana Chikitsa in Jwara Chikitsa? In Jwara, Shamana Chikitsa means the medicines which we are utilizing should do the samikarana of doshas without expelling the doshas or without exciting the doshas. So we have to see the Shamana procedure, it's a procedure. It's according to the conditions of the body, we have to change. According to Matra, a drug does Shamana or Shodhana. For example, when Snehavana is done, when too much Snehana is given, in bulk quantity, it becomes Shodhana. When a Grida is given in a less quantity, it does the Shamana of doshas. So, we cannot strictly tell that one Dravya is Shamana or not, because it depends upon several factors. So, we have to take into consideration several factors before advising the medicines. So we have to find out that even though a Shamana drug is as such told in the text, should be given according to the Matra, Desha, Kala, Upayoga Vyavastha, etc., these should be taken into consideration while prescribing Shamana drug. And we know for Vata, Brahmanam Shamanam Tueva Vayu Pita Nilasya. So for Vayu, Brahmana is Shamana. So when you give Brahmana Dravyas, it does the Shamana of Vada and Vada Vitta. So Shamana is a procedure, not a medicine as such. There is medicine, but the Prayoga depends. Prayoga determines whether it is Shamana or Shodhana. Mrida or Taila can be utilized according to Matra as Shamana or Shodhana. And we have to take into consideration the time when it is given. That's also very important. Hyastane jirna evani snehocha shuddha evahu Shamana kshudvatonando madhyamatrascha sasyade. Whilst we have to learn this from the Snehavana chapter. What he says, Acharya says is, Hyastane jirna evani, when food has digested and hunger has not happened, in such conditions, Shodhana Dravya should be given. While in Shamana Kshuddvataha, when there is hunger, when the medicine is given, it acts as Shamana. So, for giving Shodhana Chikitsa, we have to give the medicines in the time of Jirnavastha of Ahara, but hunger should not happen. In between that we have to give. If hunger happens and medicine is given, it becomes Shamana. So that also is to be taken into consideration while we prescribe medicines. So Shamana depends, the action of Shamana of a Dravya depends upon several factors, and we have to take into consideration all these factors before prescribing. And Charaka says, what is Prayoga? So this is Shamana. So what is Prayoga? Prayoga Shamaye Dyathim Yonya Manya Mudireye Naso Vishuddha Shuddhastu Shamaye Dyo Nakopaye. Prayoga Shamaye Dyathim. The Prayoga which does the Shamana. Already we have explained what is Shamana. So Prayoga Shamaye Dyathim. Vyadhi Shamana should occur by the medicines. Yo Anya Manya Mudire. It should not cause side effects or create another disorder. Nasau Vishuddha Shuddhastu. When a medicine given for one disease causes another disease, na asau Vishuddha. It is not Shuddha. It is not pure medicine. Shuddhastu Shamayet. Shuddha, pure medicine, does the Shamana, na kobayet. It doesn't increase doshas. So, this we have to take into consideration when we are prescribing Shamana Prayoga. Na asau Vishuddhaha. Shuddhastu Shamayet Yonugam. It should pacify the doshas and it should not increase the doshas. So, these things, these factors depends upon several things that we have to see. These are the main considerations in Shamana Ushadhi. What are they? Matra. So less matra, it will be Shamana. When it is too much matra, it becomes Shodhana. In Snehavana itself, he says, Nehocha Shuddhaye Bahu. For Shuddhi, Bahu Matra should be given. Shaman, Nehocha Shuddhaye Bahu. Yathokta hetva bhavacha nachaveyo vijarana snehasya anyabhibhudatvat alpatvat chakramasmi. Vijarana is Shamana and it is Alpa Matra. Anyabhibhudatvat. With the food, etc., when we are giving, it acts as Shamana. So we can prescribe medicines in Alpa Matra, can be mixed with the food, etc., or we have to see the dosha avasthas. How much dosha has been increased, accordingly the medicine should be advocated. And bala, we have to take the consideration to the bala or strength of the patient. If a patient is very durbala, he has no strength, we have to advocate less medicine. In Hina Matra we have to. And also Kala also is a very good consideration that I have told also already when Shamana should be given according to Kala. Even in the Ritu also we have to take into consideration, and Kala is two types, Rutvavekshaha, then Vyadhyaveksha. According to Ritus also. So we have to think in that terms. Kshanadir Vyadhyavasthaja Kalo Bheshaja Yogaku. Kshanadi. How much time we have to do? Vyadhyavastha, the Ama Pakwa, Pachamana Pakwa. These also we have to take it into consideration when we are prescribing the medicines. So Agni also is very much important. If a Tichanagni is there, we can prescribe medicines which have strength. But in a Durbalagni, we should not give much Tichana Aushatas. So that also should be taken into Agni, also should be taken into account, and also Koshta, whether he is Madhya Koshta or whether he is Krura Koshta or Murdu Koshta, these things should be taken into consideration. And Prakriti also, what Prakriti he has got, accordingly we can choose the Shamanadravya. And why we cannot, an Acharya cannot tell each and every case which are coming to your OP or IP. He can give an example, he can give some of the advices that you yourself have to apply. So that depends upon the Vaidya only. And Vayas also. If he is an old man, we cannot give Shamana Ushada, Tichna Shamana Ushada. While in Yuva, or in the young age, we can have even more medicines which have Tichna Guna. And Manobala also should be taken into account how much strength he has got. Manobala is 3 types, Pravara, Mathya and Pravara. Pravara can take any medicines, but Avara we should not give much medicines which are Tichna. So these are the main considerations in prescribing Shamana Ushada. So we have to see when the Shamana Ushada is indicated. That also we have to take into consideration. And in Jvara, Acharya tells, Tada Pakveshu Dosheshu Lankhanadi Prashasyade Kashayo Dosha Sheshasya Pajana Shamanodhava. Tada Pakveshu Dosheshu. When the doshas have become Pakwa, Ama has been relieved. Lankhanadi, how? By Lankhana, when the doshas have become Pakwa or digested properly, and the dosha has been decreased, in such conditions, we can give Shamana Ushada. When there is so much dosha has been, much dosha when increased, in such conditions, we have to advocate Shodhanachils. When there is only less doshas, less vitiation, in such conditions, we can have Shamana. Kashayo dosha sheshasya, shesha dosha. We have given Shodhana therapy and still dosha is there. In such a case, if dosha shesha will be there, In such condition, kashaya, shamana, pachana, shamanaha, these things can be advocated. Okay. So, it is also in Shwasa Chikitsa. Acharya tells about when shamana should be advocated and what is the utility of shamana and what is the significance of shamana rather than shodhana, that we have to understand. Sarvesham brahmane hyalpa shakyascha prayasho gadaha bhuyishtam shamane payo prisho ashakyascha karshane shamane brahmane ischabi bhuyishtam tanupachare. Sarvesham brahmanehi alpaha apayah. In Brahmana therapy, there will be alpa apaya. There will not be complications in Brahmana therapy. And shakyascha, the disease will decrease also. The symptoms will be coming subside. The symptoms will be subsided. Bhuyishtam, in Karshana, Bhuyishtam Shaman Apayah. In elimination of doshas or shodhana, there will be more complications. So, in Shwasa Chikitsa, it's a Vadika Yoga. In such conditions, we have to advocate Shamanayat Brahmani. Shamana Brahmana therapy can be advocated. Bhuyishtam Tanupatane. We have to give Shamana therapy and Brahmana therapy. So when the ama, Tapha has been decreased and Vadika or Paitika condition prevail, in such condition, Shamana should be advocated and also where Sotavodotha has been relieved. In such conditions, we have to advocate Shamana. See, we have many cases. From my practice, I can tell. When we go through, when Bhuyishta dosha is there, we can do Shodhana therapy. And after that, we can give Shamana. When there is very less doshas, when there is no need of Shodhana, in such conditions, we can directly give Shamana. I have seen that 2 days before I had a patient. It was a gynecological problem, that is fibroid uterus. And I was treating her, that is 6 to 7 centimeter diameter fibroid she was having. And gynecologist told me without surgery it will not relieve at all. And she doesn't wanted to go for surgery. She came here. I did not do any Shodhana therapy in such conditions. Rather, I advocated a Shamana therapy, that is Gulgulita Kashaya and Sukumaran Kashaya was advocated. And some other Sukumara, Arishta, all these things were given. And what happened 2 days before and after 6 months, we did the scanning. So it was 4 centimeter. The fibroid has been reduced. And 2 days before, when she came, the scanning was done. No fibroid. No fibroid in the uterus. So it was a wonderful case that shows that Ayurveda can do wonders if it is advocated in the correct way. So Shamana itself can give good results if it is advocated in the prescribed way, told by acharyas. So that is one of the importance of Shamana. So we shall see introduction. We are dealing with Jara. Amasayastho hatvatnim samo margan pithayat. That is the origin of samprapti of Jara. So when Ama has been relieved, Ama causes the obstruction of Srotas and Agni is transferred into the bodily parts, and this causes the Jara and Santapa in Jara. Then when the Srotas is purified and the Pitta comes into the Koshta, the Jara Lakshanas will decrease, and also Pachyamana Jara, Pakva Jara, in such way it relieves the doshas. When dosha shesha still happens, even after Shodhana, when purification and Sodashuddhi, in Pakva Jara, Shamana should be done. So Aushadha Prayoga in Jara is prescribed Pakveshu Dosheshu. After 7 days or 10 days of Jara, when Lagana can be done, and when there is Shodhana needed, that also should be done. After that, Pajana and Shamana should be done for Dosha Shesha. Dosha Sheshasya Pajana Shamanotava. Pajana or Shamana should be done after taking light food. So 7 or 10 days, up to 7 days, or according to the dosha visheshan, we shall do Langhana, and also after that we have to see the Samyak Laghita Rakshana, and dosha has been reduced, we have to give Shamana. So what are the Shamana preparations available in the text, and what can be utilized in this era? I have collected all these, some of the medicines from Charaka, Sushruta, Ashtanga Hridaya, and also even from Sahasra Yoga, where the Shamana Aushadas are prescribed. Different types of Kwathas are prescribed in Sahasra Yoga, and also Charaka and Sushruta and Bhakti. So we shall go through first the Kwathas, and then after that we can see what are the Gudigas which can be utilized as Shamana Aushadha. Arishtas also what can be given. And after Shamana, when all the Jara has been cured, in such conditions, a relapse of Jara can occur, and we have to avoid that. For that, what should be done? We have to switch on to the Rasayana in Jara. So these things we will consider here. So what are the Aushadhas we can give in Jara? One is Eka Parpadaga Shreshto Pitta Jara Vinashana. Parpadaga is the Agra Aushadha of Jara. And when we mix with the Musta and make Kashayas, it gives a wonderful effect. And if there is a kapha involvement more, Nibana is needed. This Parpadaga itself we can mix with the Shunti and give. So that kapha will be reduced. So the Shuddhi should be maintained, and Jwaragna property of Parpadaga acts on the patient and Jwara subsides. Or if there is a Paitiga involvement, in such condition, Dusparshaga can be missed. Just only 2 medicines. Just only by 2 medicines we can treat. I had sorry, I was good connection with one of the topmost physicians of Bangalore. He is called Gopal Rao. I had gone there and saw that he was telling me we are utilizing more medicines in the treatment. There is no need. If we have a Pathya Acharna, there is a scope of very less medicines only. We can decrease the medicines. By Pathya itself, the disease will come down, and Aushadha is a helping hand in that condition. So he used to give very less medicines. The methodology he was adapting was, he will keep all the dravyas in minute powder form. And according to that, he will mix it, like Parpadaga and Musta, mix it and ask him to take it with water or make it kashaya and take. Or Panda preparation like that, or kashaya preparation can be made. So very less amount of medicines is prescribed. And he was getting a very good result also. It's in the Jayanagar. Still that hospital is run by his grandson. So I know this is the concept. So when we have a thorough knowledge of the disease and disease pathology, we can decrease the medicines. Now what happens is, we are giving many medicines. Some of them will be having an action. Like throwing too much stones at the Lakshya. One of the stone may act and others are waste. So like that, okay, we shall use medicines when there is a severe condition. We can switch over to many medicines. Otherwise, just by simple medicines, we should be able to treat the patient. And medicines are very much less now. By utilization, forest is decreasing. Medicines are becoming very less to get, very difficult to get. In such conditions, we should not misutilize the medicines. And it is for the generations to come. They should also get the medicines. If you are misutilizing it, there will be a severe loss of medicines. So we should always think of medicines which are utilized in the less quantity and get a result. So this is one of the things. Katha, two medicines, Parpadaga and Duspersha. That's also given. Patha and Patha, Ushira, Bhunimba, Buduji, Nagara and Balaga. The Balaga, Nagara, Buduji, Bhunimba, Ushira and Patha. This also is very good preparation. We have Patho, Shira, Bhunimba, Buduji, Nagara, Balagai. This is very much utilized in the cases of, in the conditions of Doshapajana, Jara, Aruji, Trishna, Asivairasya, Apakti, etc. It's a yoga from Sahasra Yoga. Shadangam Shitagaran also can Gharachandana, Shundyambu, Parpado, Shira Sadhidam, Shitam Tebhyo, Hidam Doyam, Pajanam Tujwarabaham. Mustaparpadagam is Agre Ushadha in Jwara. Mustaparpadagam Jwari. In Agre Ushadha he says like that. Dhanachandana Shundyambu is Shadangam Kashayam, that is in prescribed in Sahasra Yoga. That also very good, it gives very good result. Ghana, Chandana, Shundi, Ambu, Parpada, Ushira, Sadhidam. There are 6 medicines. That is why Shadanga. Ghana, Chandana, Shundi, Ambu, Parpada, Ushira. Very nice preparation it is. The yoga, what is the difference between one medicine given in one disease and the difference between yoga which comprises many medicines? Many medicines, when it is given, it covers many of the symptoms of the disease, different condition of the disease. Even though we are not sure about the vikalpa of doshas, when a yoga is given, it gives good result. Otherwise, if one medicine, one drug only, when it is given, we have to be precise how much dosha has been increased, in what dosha is increased. But in yoga, we can have, it manages the whole, in the holistic way, the conditions of jwara in a person. So that is the difference. So kashaya according to doshadikya, we can have in Vadiga jwara, Duralabha, Amrita, Musta, Nagara. There is 4 medicines only, Duralabha, Amrita, Musta, Nagara. We shall have Vatha and give it. And Pippali Mula, Guduji, Vishwabheshaja. Only 3 medicines. And when there is a Vadiga increase, Vata increase in jwara, Agama, Apagama, Kshoba, Mriduta, Vedanoshmanam, Vaishamyam, Tatra Tatrangi, Kastasur, Vedanas, Chalaha. When these symptoms are seen, in such conditions, Kaniya Panjamula is. Kaniya Panjamula can be given. Lakhu Panjamula. Lakhu Panjamulam can be given in such conditions. Iswam Brihatyam Shumadi Dvaya Voturagai Smradam. That is Kaniya Panjamula. That can be. Uduchyadi Kashaya also can be, or Panchamula Adi Kashaya also can be advocated. That's prescribed in Sahasra Yoga. While there is a Paitika Jwara, the Shamana Dravyas prescribed in the text is Shakrayava, Indrayava, Ghana, Musta, Kaduka, and also Chaudra. These only 4 Dravyas we can make Kashaya and give it. So these things are Pittagna. And Mustapar Padaga, Dhanyayasha, Bhunimba also can be given. It also is Pittagna, Bhunimba. Bhunimba is very much Pittagna. And Kirata Dikta also it is called. It is very effective in the treatment of jwara. That is why we are giving Sudarshana Churna, Sudarshana Gudiga. In this Corona period, COVID-19 period, many of the conditions of jwara can be managed by Sudarshana Churna, which has ingredient Bhunimba. So Bhunimba can be Mustapar Padaga, Dhanyasha, Bhunimba, then mixed and given as Kashaya, certainly is very effective in the conditions of COVID-19. And Lothra, Ulparadi, Kashayam also, Lothra and Ulpala are Pittagna. We have to see the conditions of Pitta increase and give this Kashaya. Trayamana is Brahmi and Govangana also, Trayamadi Kashayam and Govangana Kashayam also can be given. Both are Pittagna. That is from Sahasra Yoga Jwara chapter. So, while in Kabhaja Jwara, Vrisha, Gangeyi, Shingaveda, Udalapa and Vatsagadi Gana can be given. Vatsagadi is prescribed in the Kabhaja. Vatsagadi decreases Kabha. Vrisha, Gangeyi, Shingaveda also Duralabha. All these things can be given. Mustadi Kashayam also is advocated in the Jara conditions. Pathya Tatphaladi Kashayam also, that is from Sahasra Yoga, we can have. So we have to see the condition which of the dosha is more predominant in the Jara. Accordingly, we can prescribe any of these medicines. When there is a samsarga, now Jara, formerly, there was no much importance to the Jara because in modern science we were saying that Jara is only a symptom and also we can be managed with many of the drugs prescribed in allopathic medicines. When COVID-19, the pandemic came, we were in a difficult conditions. We cannot manage in with a medicine because this cause this is the COVID-19 is a disease which affects the whole system of the body. And different causative factors are involved in it. Rather than managing the temperature, we have many difficulties in the approach of COVID-19. It affects all other organs. So the medicine should have a holistic approach. The causative factor comes from a lifestyle. And the disease affects whole life, whole person, all organs. So, in such conditions, a medicine which or medicinal system which has a holistic approach can only treat the disease as such. That is why Ayurveda has significance. Ayurveda sees the body, not the invading organ. It gives importance for the Kshetra Bala or immunity. And we see in COVID-19, one man will be affected, the other man is not affected. Or one man will have severe symptoms and the other man does not have. So we found that those who have less immunity, they are Vyadhi Kshamatva, less Vyadhi Kshamatva, he gets the disease. So rising the immunity and medicines which have a working condition in a holistic approach in the body can only give a result. So that is why we have seen many of our yogas, which are Balaji, Ragadi, Dasamula Ganutraya, all these things, they have got a holistic approach. It approaches the doshas and maintain the samadoshatva, and jara is reduced or cured. And immunity is rising. While the modern medicine, when they are given, the immunity becomes less. So, this is the condition we have to see in a body. So, we have to see what the doshas have been, what are the doshas involved in the process of samprapti. So, when there is a samsarga, in such conditions, it may be Vada-Paitika Jwara, we have to switch on to Drakshadi Kashaya. It can be given as Hima or Panda, Jadi Kusuma Vasita, Drakshadi Kashaya can be given. Jayatyanila Vittajam, Vada-Paitika disorder. So Vada-Paitika disorder, we can see this Vada-Pitta Jwara Lakshanas, Tapahanya, then there will be waxing and waning of the temperature, pain in the body. In such conditions, we have to see that it is samsargaja vadapaitya. So, entirely different medicines have to be given. That is, drakshadi can be effective. So, praksheva dravyas madhu sita laja, vagapitta jara, madatya, and it relieves the relief for madatya, chardi, murcha, daha, shrama, bhrama, and also urdhva, the raktapitta, pipasa, kamala, surasa of kaduga prepared in karpara also can be. Vatapaitiya jwara we can give. So the Akshadi Kashaya is the best option in the cases of Vatapaitiya jwara. So what we have to do in Vaka when it is Kaphavada jwara? We have to switch on to these type of drugs which are Kaphavadagna, Vacha, Tikta, Padha, Arabudha, Vatsaga with Pipali Churna. So that Pipali Churna it decreases the Kapha and Vata. And Chinodbhava Kashaya can be given. Patya Kustumbariyadi Kashaya, that is prescribed in Sastra Yoga, can be given. When there is Pitta Kapha, Jara, Arabudhadi is the best medicine. With the honey we can give. Tikta, Visha, Vishira, Trayandi, Triphala, Amrita also can be made into Kakwatha and given. So when there is a Sannipada Jara, we have to see, we have to give these types of Vyakri, Devadaru, Nishakhana. Vyakriyadi Kashaya, it is given in Parshvashula also. When the in Jara, when the person has pain in the lateral sides of the chest, in such conditions, Vyakri is a very good, Vyakriyadi Kashaya is very much, Vyakri Shundhi Amrita Kwadha. Vyakri, Shundhi, Amrita. Just 3 dravyas we can make into Kashaya and we will get a very good result. I have seen from my practice, it is very effective. Devadarvadi Kashaya also, or these things can be made into Kashaya and given. Sarvajvara Nasana Yoga is Madhuka Pushpadi Hima Kashaya, Jatya Malagadi, Nataradi, Amritottara Kashaya. Nagaradi Kashaya can be given for Amritottaram. There are 3 dravyas in Amritottaram, Amrita and Shunti and Haridagi. Only 3 dravyas that can be made into Kashaya and given. Nagara Amrita, Haridagi Kramat, Nagahasta Nayanangri Bhagasha. This is the Nagara Amrita Haridagi. That is Amritottara, it can be given. So Vishamajara Kashaya also is prescribed in Jara chapter. Kalingaga, Padolam, Padolapatra, Kadugarohini are prescribed. Kalingaga, Padolasya, Patram, Kadugarohini. These are the yogas. Just Padola, Shaharipa, Musta, Padha, Kadugarohini. These can be given. All have ingredient of Padola in this. Nimba, Triphala, Murdiga, Musta, Vatsaga, and Kirata Diktaga, or Amrita, Chandana, Vishwabheshaja, or Dhatri, Musta, Amrita, Chaudra, Bhargya Digashaya. This Bhargya Digashaya is a wonderful Kashaya Yoga which I used to prescribe for many of the patients. Shwasakasa and also Jara gets very good result with Bhargya Digashaya. Some of the pharmacies make it. You can get it from there or make Kashaya and given. It is Jwaragna as well as Kasa Shwasagna. So Bhargyadi Kashaya is very much effective in the cases of COVID-19. It relieves the Jwara, not only the Jwara, it gives the protection for the respiratory system. And cough, etc. will be relieved. Kapha, it is Kaphagna, and gives an immunity for the body against such disorders. It's also Pittagna also. Pitta is increased in the cases of COVID-19 cases of Jara, etc. So we have the drugs which are Pittakara should be avoided. And Bhargi is even in hyperacidity cases, it will be effective because Tikta Rasa. So it's a wonderful drug, can be utilized in the conditions of Jara. So Vishamadjara Hara Yoga also is there. Praga Savairam Lashunam. That we have to see condition, accordingly we can give Vishamadjara Hara. Pragbhaktam Jirna Grida. Grida can be given, if Induganda Grida can be given. Induganda is prescribed in the cases of Jara. Pragbhakta can be given as, Induganda Grida can be given as Pragbhakta. Shatpala Grida also. Panchagola eva Kshara Shatpalena Pajet Grida. That is very effective. Kabhahara, and also it gives bala for the body so that immunity can be raised. Shatpala Grida can be given. Any disorder, if you want to have immunity against this disorder, the last resort is Gridabhana. Grida gives bala for the patient. It increases ojas and there will be immunity against disorders. Kalyanagam Grida, Panchagabhya Grida, Tikta Grida, Vrisha Grida, according to conditions we can utilize. If there is a condition relapsing of the Jara, there is Kirada Dikta Adhikashaya, Kirada Dikta Gamdikta, Musta Parpada Gomurda, Handi Pita Anijabhyasad, Punaravartakam Tuaram, Charaka Samhita, Jara chapter. Kirada Diktam, Musta Parpada Gomurda, Handi Pita Anjal. Very less medicines. It is wonderful. It gives him wonderful results. I had told about this Kashaya in the last class, which I gave it in the cases of allergic vasculitis. I described it. So this is Punaravartaka Jara conditions we can give. And Grida preparations, Pipalyadi Grida, Tilloga Grida, Vadiya Jara, Tilloga Grida, Tikta Grida and Vrisha Grida, Palanika Siddha Grida in Pitta Jara, Vidanga Savarchiradi Grida in Kaphaja Jara also can be given. And Kshira Kashaya is the Shundi Kharjura, prepared Kshira, Daksha Bala, or Panjamuli Sudam. Panjamula can be named to Kshira Kashaya, can be given. Swasa Kasa Shirasula, Erenda Mula Sudha, Balavillam, also the Baddha Anila Varchas. In such conditions, Erenda Mula can be given. Vrisha, Vrishchiva, Bilva, etc. Vrishchiva is Punarnava, Bilva, that is Jara Shobha. When it is there, we can give. Shimshaba Sarasitham in Ashu Jara Abaho. Shimshaba Siddha is Ashu Jara Hara. It will relieve the Jara in with less time. Okay, so Kshira Kashaya also can, it becomes Balya. Bala can be regained. We have post-COVID cases. We have many post-COVID symptoms. With the post-COVID symptoms, patient come. In such conditions, what is the criteria we have to use? What are the medicines we have to use? It depends upon what are the symptoms the patient shows. So accordingly, we can have Shamana Aushathas can be given, and we can have um, Brahmana therapy as such with Dhrabana, with Shakpala Ghaga, etc. So that Bala is regained and the disease that does not relapse. Many of the conditions we have cough and also dyspnea occur for the patients, and he will tell, I cannot walk at all, I feel very much fatigue and also pain in the joints, etc. will be there. In such conditions, it can be fully relieved by Gridabana or Kshira Kashaya yogas. So other formulations from Sastra Yoga is Rasna Shunti Adigal, Rasna Shunti Adigashaya. It is very effective when it is given in Manyastambha, Andravritti, Rasna Shunti Guruji, Sahachara Jaladabhiru Pathya Sadakve, Tikta Kachura Vajanala Niguraside, Panchamula Dvayena, Evirdabi Kashaya Sturita Mahare, Pita Matra Prabhava, Manyastambha Andravritti, Jara Pidagagadi, Sandhi Sarvanga Vida. Pita Matra Prabhava, that's very important. Just by taking the medicines at that time itself, the action starts and your disease will come down. So Rasna Shuddhyadi is such a wonderful drug which can be given in the conditions of Jara. Rasna Shuddhi, Uduji, Sahachara, Jalada, Abhiru, Pathya, Sadahui, Tikta, Bakachura, Vasanala, Ripusaide, Panchamula Dvaye. So Tvaritamabhare, Pitamatra Prabhava, Manyastambha, Andravritti, such conditions also when after post-COVID cases, this is very good medicines to be given. Chinnodhavadi Kashaya is there, Sannipada Jara with the Murcha. In such conditions, Chinnodhavadi can be given. Brahmi Drakshadi Kashayam is there, that Sakala Pavana Vyadhi. All types of Pavana Jara can be relieved by Brahmi Drakshadi. And Valiya Nagaradi Kashayam from Sasrayam, Nagaradi Kashaya is there, that also can be given. And okay, so we have gone through all the Kashayas. So whenever a Kashaya is given, we used to mix it with Gudiga, or otherwise also with Kashaya also Gudiga can be given. What is the importance of Gudiga in the Jara is, Gudiga after many types of minute grinding, it becomes sukshma. So that it is very much it gets into the body very easily, pass through the channels and gets affected very much. So Gudiga by grinding many times with some of the medicines, it becomes activated. It becomes activated rather than the Kashayas or other things. It is Sukshma and goes through all the channels and it shows wonderful effect. So Chukkundi Palyadi Gudiga, when it is given, Jara certainly comes down. And there is Jarangusham Gudiga, and even Bilwadi Gudiga can be given. Ventumaran Gudiga also one of the main drugs which we used to give in the Jara. Surya Prabha Gudiga, Sudarsanam Churnam, and Amrita Arishtam. And other than this, we used to give a medicine which is called Vishamadjarantakam Gudiga. You can utilize it from Kottakkal. It is prepared also. I don't know whether it is available or more than it reduces the Jara, the temperature within no time, just like a paracetamol. when it is given inside with some anupanas, within no time, within 1 hour, the temperature comes down. The patient will perspire, sweats and temperature comes down. Such a wonderful drug, the Vishamadhyarantaka is. I have given it in many patients, and we can see if too much temperature is there. Ayurveda also has such wonderful drugs which we think that emergency can be managed only by allopathic medicines. There is nothing like that. Even there are many medicines in Ayurveda which can be utilized in the emergency conditions. So one of them is, I can tell you, Vishamadhyaranta and Gudiga, very much effective. So there are formulations from Chikitsa Manjari. One part of Chukka, that is Shuddhi and Dhanyaka. 2 part indicated Moha and Amadhyara. So when symptoms, according to symptoms, we have to utilize the drugs. Kirata Adikashaya can Chiriya and Valiya Kirata Adikashaya, big and small. Pajanamrtam Kashayam is there. That also Pittadna. Pajanamrtam Kashaya is Pittadna also. That is utilized in the Tikajwara. Sumishana Venu cures Sannivadajwara in 3 days. So, according to Rutu also, Sannivadajwara, Hemanta Shadibadikashaya can be given, or Shishira Padmagadigana can be made into Kashaya and given, Vasanta Anjanadigana Kashnu, and Grishma Guduchyadigana can be given, and Varsha Padola and Sharat Chinodbhavadigashay. So we have medicine Gudigas also, according to the Shastra. Jwarangusham Gudiga should be given, Mahajwarangusham, Mukamukadugadi, and Pradaba Martanda Rasam, Narayani Tailam, Prasarini Tailam, Indrani Tailam, and Panchasneham. All these are prescribed. We can give in according to conditions we shall prescribe it. Mukamukadugadi is very much utilized in the Kerala, and even Jwarangusham also is used, Mahajwarangusham. These can be given. So Lakshmi Vilasar Rasam is a very good choice for in Jwara. And Tribhuvana Kirti Rasa, Vishamadhyaranta Gudiga I have already told. We have to see formulations used according to Desha, Kala, Vayas, Bala, Satmya, Prakriti, Ojas and Vyadhi. That we have to see. We can prescribe any medicines, but we have to see where it is indicated. So Shastra Bodha should be there. We should have Yukti. According to that, we can utilize the different types of Shamana Ushadhas, and it is the clinical wisdom which gives rise to the utilization of medicines and successful treatment methodology. Any of the medicines we can utilize according to the wisdom. See, we have even we have Tulasi. Tulasi is a very good drug which will be kept in front of our house. It can be made into kashaya and given into the patient. So we have abundant types of medicines available. Medicines are always there, but we should know the principle of Tridosha concept, and accordingly we have to use. Then only it will be successful. So Shamana Ushadha, many types of Shamana Ushadhas are prescribed in the text, and I have already explained many of its types. But it depends upon how you utilize, how you diagnose the pathology and also how you would find out the Tridosha concept, which Tridosha is increased, that we have to take into consideration while we prescribe the medicines. So that is very much needed for a successful treatment. So Desha, Kala, Vayas, Bala, Sapya, Prakriti, Ojas, Vyadhi, we have to take into consideration. So it's 9 o'clock. I have one more meeting now. As the organizers told me to take Shamanaushadha, I have taken today the class. So if you have any doubt, okay, I can clarify it. Okay. Thank you very much for a nice hearing. Okay, thank you. Over to the
Okay, sir.
You can ask questions if you have.
Okay. Participants, if you have any doubt, you can unmute and ask the question. Sir, one doubt, sir. In Kabaja Jwara condition, after 1 to 2 months, can we give any Krida? Kabaja.
Yeah, certainly when Kapha Jwara, if there is a vitiation of Kapha, we can give Shamana Aushadas in that. We need not wait for 2 months. We can reduce the Kapha, which has been increased, and we have to switch over to other type of medicines which give immunity against the diseases. So by Jwara, certainly Jwaroshma, Dhadunva, all Dhadus and Angas, organs will be affected by the Jwaroshma. In such conditions, though the Jwara is or the symptom as Jwara or temperature has cured, we have to switch over to the medicines which will revitalize the body, revitalize the organs. So in such conditions, we are prescribing according to Ayurveda. That is why he Kashaya Panavatya Nirdashaha Injidangide Sarpir Dadyat Kaphe Mande Vadabitottare Jwale. So when Kapha is Manda, in such conditions, so we have given Kashaya Samayaushada and Kapha has been decreased. In such conditions, we have to give Gridapana or Kshirapana. Grida gives immunity or bala for the organ and also the body. So that with medicines which are Divanapajana is prepared in Grida, Grida revitalizes or energizes or decreases the all other problems which are there in the organs, and it revitalizes the organs. Okay.
How about in typhoid type of Jwara, sir?
Yeah. You had some classes about dengue fever, typhoid, etc. I think so. That's why I did not touch all these things. So,
Yes, sir, but typhoid, I little doubt how, when we can give Gridamana, okay.
yeah, I shall tell. That's why I did not touch it because some other's area who has taken class, I should not enter in it. So typhoid, we have to see. It is told as Sannipada Jwara. Sannipada Jwara, there are two types of treatment methodologies we have to adapt. One is Vyadhihara, and the other one is Nidana Viparita and Vyadhi Viparita. So Vyadhi Viparita should be given in the cases of Sannipada Jwara first, and then we have to switch over to Nidana Viparita. When there is Jwara, too much temperature is increased, it can cause casualties. So at that time, we have to decrease the temperature temperature by using medicines or Swedana, all these things. And then we have to reduce the conditions of the casualties, and after that, Nidana Viparita should be given. For managing a typhoid in a severe condition, we have to have such medicines like Vishamajwarantaka, etc., Sannipada Jwara Angusha, etc. We have to give and reduce the temperature. Then we shall go to the other areas. Amaharana, all these things we have to give. So Kashaya, in Acharya in the olden times, he was telling about the Kashaya, which is given inside, cannot digest. The Kashaya can be not digested by the Amasya because the Ama is stagnant there. Now we have another route by which we are giving medicines through the blood also in modern treatment methodology. So they are treating in that way also. It was not there in the olden times. So it doesn't mean that the other one cannot be advocated, or we cannot tell like that. We have to imbibe the new technology, new way of giving medicines. So even that is also needed sometimes in the cases of Sannipada Jwara or typhoid. If we cannot manage with Ayurvedic medicines through the oral route, we have to switch over to the other route through the blood. Also we can utilize. There is no problem in it. But eventually we have to switch over to Poshtha, and we have to manage the disease. For fully relieving from the disease can be attained only by our principles of treatment like Amasya, Amahara, Aushadhas. Okay.
Okay, thank you, sir. So that's a question. How can we treat pleurisy in COVID-19?
Yeah. One minute. In pleurisy, we are handicapped in some of the cases of pleurisy. In practical way, when we have to treat accordingly with only Ayurveda, if we want to treat, there will be eventualities in pleurisy. the patient, how the patient, in what condition he is approaching you, accordingly we have to use Ayurvedic drugs. There are some of the drugs in Ayurveda which are very much effective in the pleurisy, but we have to see the condition, bala, and how much affected by the disease he is. These things we have to take into account. Otherwise, pleurisy can be managed by many of the Kashaya yogas prescribed in the Shwasa Chikitsa and Kasa Chikitsa. And pleurisy, there is a infection there, inflammation there. So Pittagna type of aushadhas can be. And in that cases, Bhargyadi Kashaya is very good choice in that conditions. And also Gorochana the Gudiga is very good choice. But we have to see, is it in the severe condition, asadhya avastha or not? We have to see. Otherwise, if we can give medicines through the oral route, and we can have Ayurvedic medicines. Otherwise, if he is too much ama is there, we have to go for ama chikitsa, amahara aushadhas, then only we can give these medicines. For gudigas, etc., like Chukkandipalyadi, Vettumaran Guliga, etc., it when they are given, it doesn't need a digestion. It is vyavai. Without it passes through the channels very easily and quickly and gets into the organ and decreases the signs and symptoms. So Acharya was telling Amapajana in 3 days, for 7 days, etc., about the aushadhas of Vatha only, or Grida, etc., where it will increase harm. But in some of the medicines which are in Gudiga shape, which is Amahara also, and also it will be going through the channels very easily, Jara will reduce. And we can see the Ama conditions and decrease it by Kashaya yogas. Okay.
Can I take one more question? What medicines to give for severe joint pain after chikungunya?
Yeah. In chikungunya, we have to see the platelet status, and in such conditions, we have to see the how we can manage it according to Ayurvedic medicine. We have to see it. But in the cases of chikungunya, pain after chikungunya, that can be managed with well by Ayurveda, and it can be managed by Ayurveda only. Because what we have to think about, how this pain occurs after chikungunya. The doshas are affected in the joints, and though the temperature has come down, the joint pain will be there. That means every disease starts with kapha and passes through pitta and ends in vada symptoms. So vada symptoms can be shown. Vada symptoms are one of the vada symptoms is joint pain. So it has reached